Alors, nous allons procéder à ces échanges en se penchant sur la lutte anti-tabac
Hello, everybody.
et revoir le cas
Today,
spécifique de
we will be
l'application
discussing
mondiale de
tobacco
critères
control in
pour les
Chad,
cigarettes.
and specifically the implementation of warning labels on cigarette packages and tobacco industry interference. To talk about that, we have Mr. Daouda Elhadj Adam, an ardent tobacco control activist in Chad. He is the Secretary General of the Association for the Defense of Consumer Rights, ADC, a member of the African Tobacco Control Alliance. Mr. Daouda, Chad's tobacco control law of 10 June 2010 contains provisions aimed at significantly reducing the marketing and consumption of tobacco, including the introduction of pictorial health warnings on tobacco product packages. Tell us a bit about the process that led to this provision.
Thank you very much, Atka, for this memory refreshing exercise. It is a great honor to be able to share this experience with other tobacco control actors so we can learn from it.
Et comme vous l'avez si bien souligné dans votre mot introductif ou dans votre question, le fondement des avertissements sanitaires.
As you so well pointed out in your introductory remarks, the pictorial health warnings that Chad has adopted are based on the Tobacco Control Law of June 10, 2010.
Cette loi consacre 5 articles principaux.
This law establishes 5 main articles that provide for health warnings that must cover at least 50% of the main surfaces, and these warnings must be in the form of images combined with messages that occupy both the front and back of cigarette packs.
Qui vont occuper donc à la fois le recto et le verso donc des paquets de cigarettes. Cette loi énonce donc plusieurs mesures concernant donc les sanctions, n'est-ce pas?
This law sets out several measures concerning sanctions for implementation. Chad's tobacco control law gives health authorities the power to implement health warnings.
Il faut dire qu'après son adoption,
After its adoption in 2010, we had to wait until 2015 to obtain the decree implementing health warnings. But during this time, important work was done by the Ministry of Health in close collaboration with civil society, especially the Stop Tabac Chad platform, which ADC leads.
Assure le leadership. Et donc, ce travail, société civile,
This initiative, involving civil society, the government, and partners such as the International Union Against Tuberculosis and Lung Disease, helped the Ministry of Health to develop the draft decree, since the law allows the Minister of Health to directly issue a decree on the subject. This is not the case in other countries where an interministerial order is required. Our law gives full responsibility to the Ministry of Health to regulate the implementation. I think this is an important point to emphasize and one that has facilitated implementation. There was a draft law that was prepared, validation workshops were held, and focus groups were organized to identify the images that would be effective for the Chadian public, but things were slow. The trigger for the implementation came from the alternative report of civil society, which was financed at that time by the Tobacco Control Consortium and FCA. The report was used to make a case to the highest authorities of the country, the National Assembly, the Prime Minister, And it is from there that firm instructions were given to the Minister of Public Health to implement the policy. This led to the signing of the decree and the official handover to the tobacco industry in the presence of the media.
Et également la remise officielle sous, n'est-ce pas, nos conseils avec le ministère de la Santé, la remise officielle aux industriels du tabac pour que ce ne soit pas un courrier. Et on prend les médias à témoin. Et puis, immédiatement, et c'est là où l'industrie s'est réveillée et dit, ah, voilà, on leur impose un arrêté sur les avertissements sanitaires.
That is when the industry understood that they were required to have health warnings that cover 70% of the main surfaces of tobacco packages. The first ever of such occurrences in Africa, by the way. The industry reacted by writing letters. They reacted by seeking an audience with the Minister of Health. Together with the Minister of Health, we combined our efforts. We advised the minister not to receive the industry directly, but in the presence of civil society, which is one of the guarantors of the implementation of this measure, and in accordance with the directives of Article 5.3 of the WHO FCTC. The minister and his staff agreed, and that is how the industry was welcomed by Minister Dr. Ngariera, to whom I pay tribute for his political courage in favor of health. The industry was surprised to see a lot of people in his office. He said that he was accompanied by his staff and his collaborators, including tobacco control stakeholders and civil society. The industry was disarmed because in its letter, it had proposed to support the ministry intervening through philanthropy. They were ready to study all possibilities of partnerships, as they used to say. But they were chilled by the presence of civil society, and they asked for an extension of the deadline, saying that 9 months, as indicated in the decree, was not doable. The minister replied, stating that he had called them, agreed to receive them, and to accompany them to respect the deadline. He added firmly that he was putting a team at their disposal to work together to accelerate the implementation. He thus closed the debate, and the industry put itself at our disposal, and we provided them with the specimens of the images. We took advantage of the moment we were passing the images to them on their flash drives to do some snooping, as they always do. We scanned their drives, and that gave us access to their analysis and the response strategies they had planned.
C'est très édifiant, Monsieur Daouda Elhadj Adam. Et vraiment, je crois que c'est
That is very edifying, Mr. Daouda Elhadj Adam. I believe that in this respect, Chad is an example to follow. Speaking of the actual implementation of this provision, it has been a decade since the provision was made, and we would like to take stock of its implementation with you. What has been done? What has concretely been achieved?
I think the implementation is a bit mixed. The implementation of these images has been effective since the decree was signed in February 2015, and the tobacco industry was given a 9-month deadline to comply. This deadline was respected. 9 months later, from the 1st of January 2016, we have the images on cigarette packs on the market with shocking warnings. This shocked the whole public and played its anticipated role, and 2 years later, we proceeded with the Ministry of Health to renew these images. The industry has always asked for an extension of the deadline, which is 9 months granted by the minister. Even when the minister accorded an extension of 3 months for the renewal at one point, it was eventually effective. And on the market, we have cigarette packs since 2015 till date with images and illustrated health warnings. They initially covered 70%, and now we have gone beyond that. So I would say that pictorial health warnings have been quite effective. But during the same period, the industry, in the form of importers, flooded the market with products that are not compliant with the regulations through smuggling. The tobacco industry took advantage of the weaknesses at the borders, the porosity of the borders at the level of customs, with the conflict in Libya and at the level of the Lake Chad and others. We found ourselves with a cohabitation on the market of products respecting the illustrated health warnings, but also smuggled products, which remained a great challenge for us as an actor in tobacco control. We are fighting for this. We continue to call on the authorities to fix this. Last week, we sent a letter to the Prime Minister of the Transition, who is none other than the MP who introduced the tobacco control law that was adopted in 2010. We called on him to act to stop illicit trade, and we continue to do this work knowing that the industry always takes advantage of periods of transition to influence policies. But we understand that it is our duty to be even more vigilant and to intensify the fight.
Very good. So, Mr. Daouda Elhadj Adam, since the main objective of this measure was to reduce the marketing and consumption of tobacco products, is that objective being met at the level of the population in relation to the consumption of tobacco products?
Yes, I think that the task was successful because today, thanks to these warnings, we have been able to denormalize cigarettes. This has raised the awareness of the public, especially young people, to the fact that the product is bad. Everyone runs away from the image, even the smoker. There is a study by the Ministry of Health which proves that people cannot bear these images and that they are more informed thanks to these warnings. And I think that there has been an effect. I don't have the figures, but there has been a positive impact on tobacco consumption. We feel that people have understood that the act of smoking is not normal and they are embarrassed, which was not the case 10 years ago when children were sent to buy cigarettes without any embarrassment. Now people have understood that this is sinful, so they hide. As the WHO Empower policy says, it's all about showing the harmful effects to consumers. Whereas 10 years ago, we only had gold-colored watermarks that said almost nothing to inform consumers.
Thank you, Mr. Daouda Elhadj Adam, for this time. We recall that you are the Secretary General of the Association for the Defense of Consumer Rights, ADC, in Chad.
Thank you very much, Claire. It was a great pleasure having this discussion. Thanks to Elhadj as well.